This episode is brought to you by Hyperice, the leader in advanced warm-up and recovery technology. They have tons of innovative products, like Venom-heated wearables to help soothe sore back muscles, Normatec compression boots to speed up recovery and increase circulation, and Hypervolt massage guns to improve mobility. Loved by athletes like Naomi Osaka and Erling Haaland. Try them yourself. Get 10% off your order with the code MOVE at hyperice.com.
Hello and welcome to Bytes of Health, where we hope to take a bite out of your parent worries each day with sound advice and guidance. Every morning, we'll answer a commonly asked question that pediatricians regularly receive in 5 minutes or less. I'm Dr. Jess Steier, a public health scientist, and today I'm joined by a guest physician bestie, Dr. Emma Weiskopf, who is a neurologist. She did her neurology residency at Mount Sinai and worked in clinical neurophysiology at NYU, where she had tremendous exposure to some of the sickest adults and children who live with epilepsy. Today, we are going to talk about seizures. The clock is ticking, so let's get to it. All right, Emma, what is a seizure?
Well, thanks, Jess, and thanks for having me on the show. A seizure is basically a sudden uncontrolled burst of electrical activity in the brain. Depending on the kind of seizure, it can look very different to the parents who might be observing it in their children. There are two major classifications of seizures: generalized, involving the whole brain. These can be very dramatic, like violent shaking, often with loss of consciousness, as well as absence seizures, another kind of generalized seizure, which can be brief and might just look like a vacant stare. The second kind of seizures are focal seizures arising from just one part of the brain. These could appear as shaking of one part of the body, a tingling feeling, a funny smell, or even the sensation of being panicked or on a roller coaster. Or they could even present with a child who is confused with their eyes looking in only one direction. But one definite hallmark of seizures that I want to emphasize is that while they can manifest in so many different ways, they are often stereotyped, which means to a neurologist that they look the same every time. So if a child is doing a certain behavior, but it looks very similar each time and seems suspicious to you, be it a staring spell, a spasm, as is often the case in infants, an episode of confusion, or a significant change in behavior, it's best to err on the side of caution and report this to your pediatrician.
Wow, this is so interesting. So what is epilepsy?
Well, epilepsy by definition is having two or more seizures unprovoked by anything more than 24 hours apart. If you have seizures in the setting of illness and fever, some parents may have heard of febrile seizures, or a concussion, you do not necessarily have epilepsy. That does not mean, of course, Jess, that you shouldn't seek medical attention. It just may mean that the cause of your seizure, once resolved, may not lead to any additional seizures in the future.
What are common types of seizures in children?
Well, there are many different causes of seizures in children, and it really depends a lot on the age of the child. Neonates are a whole category themselves. A seizure in a neonate can be unnoticeable even to the clinical eye. It may just appear like the newborn is not alert or is not feeding well. In infants, one of the most dangerous types of seizures are infantile spasms, and it's always good to be aware that this type exists. Infantile spasms can also be very subtle. They may be brief extensions of the arm, or it might look like the baby is doing crunches. These, if they go untreated, can be harmful to the baby's development, so it's important to report these if you think they might be occurring. When they get a little older into childhood and adolescence, a typical seizure may be as simple as a blank stare, or could be as severe as a full-blown convulsion, the kind I talked about before. Many pediatric forms of epilepsy can be due to a genetic disorder, but this does not mean that it is necessarily inherited. There are various types of genetic epilepsies, and in most forms, there is nobody else in the family who has seizures. Also, many forms of genetic epilepsy are benign and are often outgrown over time.
So, Emma, who treats epilepsy in children?
Your pediatrician is the first person to talk to if you're concerned that your child may be having seizures. They will likely refer you to a pediatric neurologist and, if necessary, even a pediatric epileptologist who has even more training specifically in seizures in kids. If you are having trouble getting in to see a pediatric neurologist, as may be true in a lot of rural areas or other parts of the country, you can always take your child to the emergency room if you're concerned. And sometimes there may be a pediatric neurologist who can do telemedicine consults.
So, what should I do if my child has a convulsion?
Well, if your child has a convulsion, one thing is many seizures will stop on their own and do not require urgent treatment, but you should take steps to protect your child from injury, like turn them on their side so they do not choke. But most importantly, if the convulsion does not stop quickly, within 5 minutes, you should call 911 for help. You should not leave your child unattended, and certainly you should contact your pediatrician urgently, especially if this is a first time seizure. Your pediatrician will likely refer you to the emergency room, especially in the case of a first time seizure, so that the necessary tests can get done quickly. Your pediatrician or the pediatric neurologist may order an EEG, an electroencephalogram, much like an EKG of the brain, and if needed, a picture of the brain like a CAT scan or MRI, as well as blood tests. In summary, Jess, if your child of any age is having an episode that seems to recur and looks similar every time, it's important to talk to your pediatrician. Most seizures are treatable and many will not recur or be outgrown, but working with your child's healthcare providers is always the safest option to keep your kids healthy.
All right. Well, I learned something. We hope you learned something, and we have lots more to share. Special thanks to Dr. Emma Weiskopf for sharing all of this incredible information on seizures today. You can get your Bite of Health every day, Monday through Friday. If you like what you've heard here, let us know. Leave us a review on Apple and be sure to tell your friends. Remember, there is no single or best way to parent. Parenting is a journey, and we are all just doing our very best. We wish you happy, healthy, and stress-free parenting.